Hi everyone, Dr. Nemechek here. Time for another week of review for the week of September 22nd. Just a quick reminder, please hit the subscribe button so you can stay abreast of all our new postings. First, we start with a 20-year-old female. She came to us just about a year ago, and she's 19. Lightheaded, fatigue, headaches, rapid heart rate, chest pain, tingling arms. Some, you might call this POTS. Also chronic depression, anxiety, and she was being treated Adderall and Lexapro without really any great benefit. This is a case of what we call cumulative brain injury, where you have multiple events happening that cause additive symptoms, and the symptoms just worsen and worsen and worsen. And so hers was initially triggered by a really emotional event amongst the family, and then there was dramatic worsening after a COVID event, infection, and then much worse symptoms after her friend died. And if she didn't have any inflammation, she would have recovered from all of these. But because of the inflammation, she couldn't fully recover, and the injuries just start stacking on top of each other. And this is a very common phenomenon. People just don't see how these pieces all fit together. So we put her on at this point, I just put her on continuous rifaximin, fish oil, olive oil, and then 6 weeks of glutamine because of the history of COVID, and marked decline, lightheadedness, headaches, fatigue. So on her 4 months later on her follow-up, we switched the continuous over to intermittent. And I just saw her, and she's still on just the fish oil and olive oil. The intermittent rifaximin, she's only needed a 10-day course since last March, which is pretty good. Basically feels fantastic. She says, I feel great. And she was successfully tapered off the Adderall and Lexapro and doesn't need anything. So fairly typical course for a young adult who has these kind of injuries and symptoms. Next is a 7-year-old young boy, bad shape, autism, no speech, no eye contact, constantly stims, just walks in circles. Okay, so the parents start him on the protocol when he's 3. This back 2021, fish oil, olive oil, and just that tiny dose of inulin every day. Better eye contact, more responsive, stimming is decreasing, can now string a couple words together, starting to interact with kids at daycare. Basically, huge awakening. Okay, this kid was basically stoned from propionic acid being produced with that bacterial overgrowth, and you relieve that and you get this big improvement. They came and saw me, was doing good, but we thought the language had stalled, and so we added the VNS, and as we see in about 80% of the cases, there's a significant bump in recovery of language, starting to ask questions, following commands more easily. Motor skills are improving, can now use a knife and forks, learning to write. That stimming that was just intense has almost completely resolved. And as of last week, he's been on the protocol for 4 years, continuing to improve, doing great in school, starting to catch up with his peers in reading, math, writing, socialization. And the mom says when they're out and about, nobody knows he's got autism. He just acts like a neurotypical kid. So we're just going to keep him on the protocol and just have him keep catching up and so forth. He's doing fantastic. 5-year-old, started just a year ago. Autistic, very few words, very poor response, hyperactive, constipation, and stimming. Pretty typical young kid off protocol. And was started on inulin, fish oil, and olive oil, just the basic regimen. Right away, increased awareness, responsiveness. The stimming, he was kind of flapping and just making noises constantly. That just completely stopped, following 2-step commands, using 3-word sentences, counting in 2 languages. Now able, like socialization-wise, feel comfortable. He can actually sit next to kids he doesn't know. Last May, because of just the frequency of COVID disrupting these kids, and everybody gets at least a 6-week course of glutamine to help if they have any COVID leaky gut. This case didn't do anything, but still, everybody gets that. It's pretty harmless, low cost, low risk, and we're just making sure we can eke out everything we can. So as of last week, still inulin, fish oil, and olive oil, trucking right along. According to mom, things are great. One thing we did notice, he's still having bowel movements about every 2 to 3 days, and that she did notice like he's more focused and calmer when he has a bowel movement. So we're going to put him on daily Miralax, and I have a new video that just came out about 2 poops a day. I want frequent stools in these kids. Even 1 stool a day. We have so many kids who go get an x-ray and the colon is still packed with stool. And that colon drops their blood pressure, makes them more hyper, more anxious, affects their focus. Got to get these kids pooping better, okay? And last is one of my older patients here in terms of longest in the practice. So he started the protocol 9 years ago at 37, severe rheumatoid arthritis that started in his 20s. He was an electrician, pretty much disabled. Pain in shoulders, hips, knees, ankles, jaw. He's got this neuropathic pain from his hips down to his feet. You might call it like neuropathy. Okay, tried several different rheumatoid arthritis medicines. He's intolerant to them. The only thing he could be on was this high dose of prednisone, like 20 to 30 milligrams a day. And from the prednisone, it's just big, round, swollen face and thinning skin, and wasn't good. Also had just poor focus, this low blood pressure, can't focus, he's got headaches, he's got the coat hanger, neck pain, and some chronic diarrhea. So we started on just an intermittent course of rifaximin, fish oil, olive oil, and 2 hours of VNS a day. Diarrhea stops, but he's relapsing very fast. He has to, about every, the diarrhea would stop, but then within about 2 to 3 weeks it would come right back. So we weren't getting the inflammation down all the way. So we switched him to daily continuous rifaximin, so twice a day, every day, no break. Just over the years, significant improvement. He's able to actually return to work. He says he's about 50% as productive when he was healthy and young, which he is happy with considering he is older. He was completely disabled before. The nerve pain that he had in his legs completely resolves. The focus headaches, coat hanger pain, they go away. And we've been able to continually, now he's been on the prednisone so long, you have to go slow. Just slowly tapering the prednisone down. And then last winter, he starts getting inflammation again. We can't figure out what it was. We thought maybe it was COVID. So we gave him a twice-a-day course of the glutamine. Didn't do anything. It keeps getting worse in May, so we added a 14-day course of metronidazole. Now, so the rifaximin has been controlling the bacterial overgrowth in the small intestine. You can have overgrowth of an organism called archaea, which is, they'll refer to this as a methane-producing organism. It responds to metronidazole and neomycin, and we gave him 14 days of metronidazole, and it worked. He could tell right away he was feeling better. And when you have this big inflammatory surge, it takes about 6 weeks for the inflammatory kind of discomfort in the tissues to subside. And he's doing great. So at this point, continuous rifaximin, fish oil, olive oil, VNS, and he's using the metronidazole anytime he feels like he's starting to get a flare. His prednisone, again, was at 20 or 30 milligrams a day. It's all the way down to 2 and 2.5 milligrams a day, which you can do fairly safely in the long term. And he's working nearly full time. He's got a small farm. He's able to do most of the work there now. And he's even able to get back in water ski, which he loved to do when he was young. So very impressive response with rheumatoid arthritis. That's all for this week. Again, hit subscribe so you stay abreast of everything we're doing. And remember, just take care of your kids, take care of yourself, keep your inflammation down. Until next week, this is Dr. Nemechek. Take care.